Okay, hi everybody. This is Alexandru Michi. I'm the chair of the Telecardiology Working Group of the International Society of Telemedicine and eHealth. I'm very happy to host this excellent webinar focused on immunity. And we have exceptional guests. Along with my host, Dr. Purvi Parwani, we'll try to highlight what we can do to boost our immunity during these tough times. First of all, I will share my screen with the message from the our society's secretary.
FESC exists to facilitate the international dissemination of knowledge and experience in telemedicine and e-health, and to provide access to recognized experts in the field worldwide. It is a non-governmental and non-for-profit society, primarily an umbrella for national telemedicine and e-health organizations, also including associate, institutional, corporate, individual, nurse, and students membership. It communicates through its website, a quarterly newsletter, member announcements, and through the International Society for Telemedicine and e-Health e-journal. On the website, you also find a chapter with all sorts of information, which we call knowledge resources. You'll find also the recorded webinars from the recent past. You will find information about the current working groups and their activities, and also under education and contributions, you will find chapters on history, good practice models, and national e-health strategies. Enjoy this webinar.
Great. So I have the pleasure to introduce you my co-host, Dr. Purvi Parwani, which is assistant professor and cardiologist at Loma Linda University at Loma Linda, California. Thank you very much, Purvi, for accepting to do this webinar. Thank you very much for your huge involvement in this webinar. I know you're passionate of yoga, so please you can have the word, please, to present further the webinar.
Thank you, Alex, for your kind invitation and making me part of this. I'm really excited, and this is probably the most excited I've been about any webinar this summer. And I've done quite a few of this, one with you. But I think why we wanted to do this is because we have seen that coronavirus and the COVID-19 pandemic is unique, and it has unprecedented in several aspects and has challenged healthcare systems, the individual household, physicians, society, and world in general. So if we look at the world, we are right now living in a quite inflamed world, and it's a wake-up call for many of us, truly. And this webinar, hence, was designed to help the healthcare provider or anyone who's feeling the pressure from the self, from the relationship that are strained in the COVID-19 pandemic, or society in general. So as a healthcare worker, I know that myself, I've gone through many emotions, many days of fear, anxiety, and nervousness as I took care of these patients, navigated the issues through PPE. And I know that it has been a challenge for many of my colleagues worldwide. So here is our attempt to give you this anti-inflammatory boost with this webinar, and we are going to present to you the practices that we all preach we all do on a daily basis. There may not be robust evidence in form of many randomized controlled trial, but it definitely helps. And the great thing is there is no downside of doing any of this. So with that, I'll have Alex present our first speaker, Dr. Beth Frates.
Thank you very much, Purvi. So I have the pleasure to present Beth, which is an assistant professor at the Harvard Medical School, and which is an expert in lifestyle medicine, and is also a health and wellness coach. If you have time, please visit her website, wellnesssynergy.com. You have it on the announcement. So Beth will be presenting stress reduction and its role in enhancing immunity. Thank you very much, Beth, for accepting this. We're waiting forward for your presentation.
Thank you so much for having me. I'm going to share some slides here and get right into it. So usually I have disclosures for CME. In this case, I will share with you two important disclosures. One is that my father had a heart attack and stroke when I was 18 and he was 52. So since the age of 18, I've been on a mission to figure out how to empower people to adopt healthy habits so that they can avoid his fate in both experiencing the heart attack and the stroke. Second disclosure is I myself was a stress head, similar to my dad pre-heart attack and stroke. And I found personally that yoga and mindfulness-based stress reduction brought me to a whole different space where I could enjoy life at work and at home. So I'd like to share with you today some of the information on stress, biomarkers, research, and physiology. And we'll start with just getting on the same page with definitions. What is stress? So really it's an engineering term, right? Pressure or tension exerted on a material object, but we're talking about it today in psychological terms, a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. I want to take this opportunity to say all stress is not bad. There's eustress or flow, which Mihai Csikszentmihalyi has an entire book on, how we can use stress to actually be more productive and creative when we get into that sweet spot of stress. This webinar is focusing more on distress and chronic stress and what that can do to our bodies and brains. Let's look at some of the research, get into the literature. And the first one I'm going to look at with you is a stage model of stress and disease. So how does stress impact us? The mechanism. So something happens, environmental demands, COVID. We have demands. There's a perceived stressor. We appraise that stressor. And then we can go into negative emotional response. This can lead us down two different pathways, and we could go down these simultaneously. One is that we start changing our lifestyles, disconnecting, eating hyperpalatable foods, excessive sugar, fat, salt, eating excessively, too much, not moving anymore, no more exercise, not sleeping, increasing our stress levels such that we are really changing our lifestyles. Then the other pathway, activation of the sympathoadrenomedullary system and the hypothalamic pituitary adrenal axis, sending off hormones, then biomarkers, inflammation. And both pathways lead us to disease-related physiologic changes that make us more susceptible to infections and cardiovascular disease and other chronic conditions. Now, let's talk a little bit about the effect of stress specifically on the defense systems, the immune system. So stress impairs our sympathoadrenergic mediated increase in chemotaxis and adhesion molecules expression, thus reducing immune cells migration to sites of infection and or inflammation, which is going to diminish our immune response. Stress can decrease our natural killer cytotoxic capacity, Substance P mediates an increase in macrophage cytokine production. And then it impairs the immune system's ability to produce antibodies in response to a vaccine, thereby making the organism more vulnerable to infections, which of course is very important in this time of COVID. Mind you, everything we're going to talk about today is important for stress reduction. However, in this era of COVID pandemic, we are going to emphasize the importance of wearing masks, social distancing, washing our hands, and being safe. So, based on the evidence, we're practitioners, clinicians, researchers here. We want to know, what does the evidence show and demonstrate are effective stress reduction techniques? So, getting out in nature or forest bathing. I'm going to share with you all of the references and resources in this PowerPoint. And as I call out the stress reduction techniques, you can find the reference right underneath it. Exercise for stress reduction, mindfulness, which we'll do a deep dive into, as well as MBSR, which is mindfulness-based stress reduction, meditation, playing with a pet, increasing our oxytocin levels to reduce stress, taking vacation, actually relaxing, taking deep breaths, turning on that parasympathetic response with the long exhalation, and listening to music. What kind? The kind you like. Practicing yoga. We're going to take a deep dive into that one too. Laughing. When was the last time you had a good belly laugh? I co-authored a paper in the American Journal of Lifestyle Medicine called The Laughter Prescription. Call your attention to that. Shows all the physiologic benefits of laughter. Expressive writing can be a way to reduce stress. Look at this one, chewing gum. There's the evidence. Checking emails with less frequency. That can reduce stress. So another disclosure, I practice yoga and I have been on my paddleboard more recently to add a little more fun to the process. And maybe that adds a little fun stress, but not distress. Just enough to push me into that flow zone where I'm loving it. So let's look at mindfulness and the immune system. Purvi mentioned randomized controlled trials because that's our gold standard in medicine, and we know that. And here we happen to have 20 randomized controlled trials, mostly in MBSR, mindfulness-based stress reduction. I took that course about 8 years ago here at UMass with John Kabat-Zinn's group, and it truly transformed my life. In this particular study, approximately 1,602 patients were included, and I want to show you some of the immune system and markers that they evaluated and mindfulness has an effect on. In terms of inflammation, mindfulness can decrease NF kappa B transcription activity, can decrease CRP levels, C-reactive protein levels, can increase CD4 T cell count and activity, and can increase telomerase activity, which, as you know, can slow down biological aging. So how much mindfulness do we need? What was shown in the literature? Weekly group sessions for 6 to 10 weeks. Now let's look at yoga and how yoga reduces stress, what kind of mechanisms we can find. 5 studies were included in this systematic review. And the pathways, the psychological mechanisms by which yoga has been found to help relieve stress are with positive affect and with self-compassion. Now, when we look at the physiological or biological mechanisms that yoga might be helping us to reduce stress, we look at its inhibition of the posterior hypothalamus right here in the brain and the lower cortisol levels that are shown, demonstrated after yoga. And here's another study looking at mindfulness-based stress reduction and yoga and stress-related physiologic measures. This is a meta-analysis with 42 studies included. And it was found that these practices, mindfulness and yoga, reduce evening cortisol and waking cortisol, lower ambulatory systolic blood pressure and resting heart rate. They lowered fasting blood glucose, lowered cholesterol, and lowered LDL cholesterol, low density lipoprotein cholesterol. This was all compared to an active control. And then yoga and the immune system. Last study, it's a little study, a small study, but a seedling study, let's say, but it's interesting. Well, at least I hope you find it interesting as I did. So this was yoga stretching for improving salivary immune function and mental stress in middle-aged and older adults. The subjects were 23 women, about 60, and they were looked at before and after a 90-minute yoga stretching class, or compared to rest. And they measured secretory immunoglobulin A, cortisol, and testosterone. What did we find, or what did they find? That the immunoglobulin A concentration and secretion rate was significantly higher after yoga than before yoga. The cortisol concentration and secretion rate was lower after yoga, and testosterone secretion rate was higher after yoga. So, conclusions of the seedling study, and we need more research, but yoga stretching can reduce stress and enhance mucosal immune function in older women. I didn't like their elderly women because they were just 60. At any rate, in women around the age of 60. I disclose that I'm passionate about this topic and have been performing yoga and loving it for 15 years. I recently co-authored a guide. If you're now an enthusiast yourself, or maybe after you hear the rest of the panelists, you'll become even more enthusiastic and you want to know how to do it for yourself and how to recommend it for patients, there is a physician's guide to recommending yoga in the American College of Lifestyle Medicine. I would refer you to that. And I thank you for your time, and I thank everyone for including me today.
Thank you, Beth. That was a wonderful overview. So now I have the pleasure of inviting Dr. Mohit Gupta, who's a cardiologist at GB Pant Institute of Post-Medical Graduate and Research in New Delhi, India. So Mohit has some personal journey that he's going to be sharing with us. He has given many of these wellness lectures in the local population there, and we are really blessed to have him today with us. He'll be speaking about creating a conscious future with yoga and meditation.
Thank you so much for this opportunity. It's such a pleasure to connect from the other part of the world, and it really looks like that we are all in one boat like a family in this pandemic. As far as this talk is concerned, I have nothing much to disclose except that the effect of meditations are profound, but there is no credible research that has actually been done. So why am I here as an intervention cardiologist? It all started on 20th March 2003, when I just returned from my cardiac cath lab. And I remember the same day I had seizures and was brought in the semi-conscious stage to my same hospital just 2 hours after I reached my home. And it was just like a fight of David and the Goliath. And next day when my scans were done, I was diagnosed with multi-drug resistant tuberculosis, resistant to almost 18 drugs and sensitive only to amikacin, and every day being injected by the toxic injections, consuming 16 tablets a day. And ultimately, you see, on 20th June 2005, after an ordeal of almost 2.5 years, 1.5, 2 years, surgery was done on 20th June. And I thought that now everything is perfect and fine. But 6 months later, you see, my older surgery place was fine, but there was a new mass in the cerebellum, new lesion in the cerebellum. And I was just wondering that what am I supposed to do? I'm already taking medicines. This is not operable. And I realized that old ways are not going to open new doors. So I was in search of transformation. And with this, I believe that all the way I've been trying to transform my behavior, But I've learned to live in my life that behavior is a function of our belief system. And when I found meditation, actually meditation changes our belief system with rational logic and evidence. And that is why the word meditation comes from the Latin word, which means to think, to ponder, and to contemplate, or even to heal. And that is where I started meditation. And starting from January 2006, I changed my belief system, taking those medications, but also practicing an hour of meditation that I'm absolutely fine. These medicines are working perfectly on my body. And you see scans in April 2007, when repeated, all the lesion had practically disappeared. And this further strengthened my belief with a deeper understanding that meditation is not just about our physical body, but it's also about our own mental and emotional state of health. So having said that, I've learned that, meditation is having a very powerful effect on our genes, on our telomere length and telomerase activity. It is also having a very powerful effect on our immune system. The lymphocyte spans the natural killer cells, and it also decreases the inflammation. So let us see and examine each one of them. So is my gene my destiny? And the science of epigenetics, the study of molecular switches that turn the genes on and off, that is what epigenetics is. And in one of the seminal studies by Duramani et al. And published in PLOS One, in which they studied transcendental meditation in patients of hypertension for 16 weeks. And what they saw was that in addition to the routine healthcare, when they were taught meditation, it demonstrated that there was a significant increase in telomerase gene expression and significant decrease in blood pressure. And what is the significance? I'll talk about this. Similarly, one of the very important studies, the only randomized controlled trial properly conducted with transcendental meditation, was with Dr. Robert Schneider, who showed that there was almost 48% relative lower risk for death, heart attacks, and stroke with a meditation program focusing on the transcendental meditation. And that is why the Wall Street Journal in 2013 prescribed that 20 minutes of meditation twice a day. But this didn't took place because actually the lot of evidence was not there, more evidence we needed. So we conducted a very beautiful experiment in our own hospital, and we started studying the telomere length of very young patients who were coming with heart attack. They didn't have any conventional risk factors. They were non-smokers, non-diabetics, no family history. But 90% of them had significant psychosocial stress. And when we examined their telomere length, you would be surprised that they were chronologically of the age between 18 to 30 years, but their biological age was almost equivalent to a person of 60 to 80 years. And this study is ongoing. And when we examined that, it is all because of the telomerase activity. The lack of meditation, the lack of happiness, the lack of gratitude, the lack of self-love, the lack of positive outlook in life is what decreases the telomere length. And this is really revealing. And this was the most important factor that was predictive of the decrease in telomere length in our study was the significant psychosocial stress. We examined the further study, and one of the recent studies published in 2017, which showed that meditation positively influences our telomere length and also telomerase activity. What is the dose and the prescription? Very nominal. 5 times 20 minutes every day for only 3 months is what is needed to change your own telomere length. You have the power to regulate your own genes. Never ever this has been shown earlier. Even the cancer patients who had increase in telomerase activity with mindfulness meditation. So more and more evidence, but less organized evidence is coming in. And sooner we are going to understand that, yes, we are going to regulate our telomere length. What about the immune system, you see? The impact of meditation on the immune system is immense. As Beth rightly mentioned, I'm just recapitulating the same thing, that different forms of meditation result in increase in natural killer cells, B lymphocytes, whether it is transcendental meditation, Qigong meditation, Raj Yoga meditation, all of them having significant higher natural killer cells. What are they doing? This positive alteration is killing the abnormal cells. And look at this. Early defense against the viral infection. Virus is one word we are all afraid of today. So if we have the more powerful immune system, that's it. That is what we needed. So, and it's not doing any harm. So 20 minutes every day is what is going to work magic. We talk about inflammation. As rightly mentioned, chronic stress is suppressing our immune function by inflammatory response and releasing pro-inflammatory cytokines. All the forms of meditation systematically in different meta-analysis with recently released meta-analysis, which I'll be showing, showed that decrease in interleukin-6, TNF-alpha, CRP, all these are significantly decreased and suppressed. So the earlier paradigm was that, you know, your DNA isn't your destiny. We had a fixed DNA makeup. But, you know, now it is very well known that your DNA isn't your destiny. The new science is revealing that you can control your genes. Look at this revealing study, amazing study, that the meta-analysis in 300 meditation practitioners, 8 anatomical regions. What happened? Just 15 minutes of meditation, not more than that. You have 1,440 minutes a day. 15 minutes only for your own self in the morning and 15 minutes in the night. That's all, my dear friends. 30 minutes every day out of 1,440 minutes. See the level of synchronization that is happening. The beauty of synchronization that is happening. Both the hemispheres, the right and the left hemisphere, synchronizing the neurocommunication of thoughts. The responses are multiplying, more integrated system, optimizing mental health and the emotional health. This is what we need. My dear friends, we are going through turbulent times. We call ourselves evolved human beings. We are scientific, we are strategic, reasonable, analytical, accurate, decisive, and logical. But this is going to take care of 50% of your life, not more than that. I've learned to live in my life that if we want to be really successful in our life, we also need our right brain to function, which is creative, which is passionate, vivid, which is intuitive and loving. This is what meditation brings upon. The harmony between your left and the right brain. And when you are functioning as an integrated system, magic happens in your life. So meditation is about creating your own conscious future, designing your thoughts, designing your destiny, but only and only if you believe. It's our belief system that can work magic. If I just put questions, oh, whether it is going to function or not, no. As an intervention cardiologist, I am operating so many cases, but I also instill faith and belief into my poor patients that yes, when you are treating your own mind, we are not just mopping up the floor, which everybody is doing. We are also turning the tap off, and that is what is needed today. So we are far away from meditation being the one-stop shop, but yes, we are soon going to reach that place that yes, we have more and more evidence that meditation will design our own life. Thank you so much.
Thank you so much, Mohit. It was really, really lovely to hear your experience, and it really touched me. We will follow next with the presentation of Dr. Purvi Parwani. Dr. Purvi Parwani is a cardiologist and assistant professor of medicine at Loma Linda University. Her clinical interest involves cardiovascular disease prevention and diagnosis and women's cardiovascular disease. She believes that cardiovascular health starts with physical and mental well-being and focuses on lifestyle modification, exercise, diet, and yoga for her patients. Thank you very much once again, dear Purvi. You have the word.
Thank you, Alex, for that lovely introduction, and thankful to all of you for joining. So, the disclosures. So obviously I practice yoga, and that's my biggest disclosure for this talk. But I think I wanted to also say that effect of yoga are profound, but no research so far exists for yoga and COVID-19. So my plea to all of you is to wear a mask, practice social distancing, and wash your hands as much as you could. So this is my another disclosure that I do wear a mask, and this is my profile picture on my social media profile. So I think that this webinar is in no way a substitute of what we are doing. It's an adjunct to what we have been doing. So I'll be speaking about Ashtanga yoga, the 8 limbs of yoga, as well as the polyvagal theory. And so Ashtanga was invented by an ancient Indian sage. His name was Patanjali. He wrote around 196 Sanskrit sutras, which are basically kind of like collection of theories and practice of yoga. And he described yoga as having 8 limbs. And I'll provide you the overview of 8 limbs of yoga and how it is related to the inflammatory response in the body. So, let's see. So, did Patanjali ever think that one day in 2020, yoga will, or for many years now, yoga has been a worldwide practice. So yoga has its own NIH page that claims that almost 1 out of 7 Americans practice yoga. More than 80% claiming that it reduces stress for them, as well as improves their overall health amongst the other. So what are the 8 limbs of yoga? When most people think about yoga, they think about the asanas, which are basically the physical poses. And this is a shame because the modern practices has removed and separated this metaphoric wrapping paper from the gift itself. And they basically take the wrapping paper instead of the gift that yoga presents. So most of the practitioners of yoga have heard of the 8 limbs of yoga, which is yamas, niyamas, asanas, pranayama, pratyahara, dharana, danya, and samadhi. So, and these are integral to each other. And I'll be speaking first about the yamas and the niyamas. So what are yamas and niyamas? So yamas and niyamas are basically observances of our interpersonal relationship and how we consciously decide to interact with people around us and the personal discipline that we bring. So this would be the compassion, the kindness, the forgiveness, the positive emotions, honesty, letting go, purity, minimalism, commitment, contentment, self-discipline, etc., etc. All hard things that we don't like to practice. So many experts now say that these should not be taken as the moral restriction or imposement on the human beings, but rather than the natural outcome as we get into touch with ourselves when we practice yoga. So I just like to put some evidence, although Beth and Mohit has presented this very well. But if you look at this very interesting study on the love kind meditation, which is one kind of meditation through which the practitioner silently reiterates the positive phrases, which is basically practicing yamas during the meditation. And this was very well cited, and it's a meta-analysis. It consists of 24 studies, and it showed that the love kind meditation provide daily association with positive emotions. People felt better about themselves, and also the short-term association was also described. So the next phase, the limb number 3, is the asanas. So as is seat in Sanskrit, and ana is breath in Sanskrit. And asana means that sitting with your breath. And when we sit with our breath, we bring awareness. And during the asanas, the forms, the physical forms are changing. So these are the traditional yoga that most of you probably identify with. So as we know, during the yoga, the forms are changing, but our awareness remains constant. And that's the beauty of asanas. So there have been many studies that have been highlighted already, but I again wanted to cite this very well cited study, which showed that while doing yoga, there is increase in heart rate variability, which is noted as the cardiac parasympathetic modulation. And we'll come to this, why this matters and how this matters. So limb 4 is the pranayama. Pranayama is the breathing, and there are thousands of pranayamas are described. These are the ones that I'm showing. Those are my favorite. And pranayamas is basically the balancing act of nervous system that we do through breath. So there are, so basically there are specific pranayamas to increase your metabolism, to fight your inflammation, to lower the heart rate, to increase overall lung capacity, But I think the main thing tying all of these pranayamas together is its effect on the autonomic nervous system that we are going to discuss when I describe the polyvagal theory. So this is a randomized controlled trial on breathing that demonstrated a significant improvement on the hemodynamic parameter, but also the reduced stress, the improved mood, as well as the self-esteem and the openness after doing the breathing exercises. And there is tons of literature that's available on effect of pranayamas on psychological disorders. And a lot of patients with trauma, PTSD have helped through pranayamas. So the next 4 limbs that I'm going to describe is pratyahara, dharana, dhyana, and samadhi. And I will describe this at once because I think they tie very well together. So pratyahara is basically the sense withdrawal or the introspection. So when we are doing extrospection, we are utilizing all our sensory system. We are utilizing all our energy to focus on the things that are in the outside world. And pratyahara, what pratyahara means is withdrawal from all those senses and kind of doing the introspection. So when COVID started, my father once sent me a message which said that if you can't go outside, if you don't go outside, look inside and look inward. And that's exactly what pratyahara is. So pratyahara, this introspection can be done with focus on the breathing. It can be with focus on in between our eyes, which is one of the chakras, or focus on any other sensory inputs that I have shown here, which has different chakras, and they show the energy points that we have in our body. So from pratyahara, one further exceeds, or one further promotes themselves to concentration and the meditation. And I think the way this all these work is by turning the mind to the positive qualities, and those positive qualities eventually become dominant, and the negative qualities or negative reactions are weakened. So a few days ago, I was talking to a friend, and really it's developing a tolerance to the noxious stimuli. If someone is annoying you constantly, how to withdraw from that sense and how to develop so much of mental strength that that person or that emotion doesn't matter anymore. So that is all, in general, the principles behind these 4 limbs of yoga are. So the consciousness, the introspection, the repetition, which ultimately leads to the goal of these practices, which is samadhi, which is also known as transcendence. And this is the ultimate goal that is described by Patanjali in this practice. So AHA in 2017 came out with an official statement on meditation and cardiovascular risk, and acknowledged the efficacy of different meditative practices on the primary and the secondary prevention in cardiovascular disease, on blood pressure, smoking cessation, insulin resistant, metabolic syndrome, atherosclerosis, of course, not to forget the extensive research that is available for psychological as well as a response to stress. So now going to the very interesting next part of our topic, which is discussing the polyvagal theory. So polyvagal theory is very interesting. It was described, the modern father of polyvagal theory is Dr. Stephen Porges, who some of you may have heard about him. So he described it recently, although it was mentioned before. So it explains 3 limbs of our nervous system, and it focuses on this autonomic ladder. So on the top of the ladder is, the ventral vagal nervous system, and this is when our heart rate is regulated, our breath is full. We take, in the faces of the friend, we can tune into the conversation, tune out the distracting voices. We can connect, we can look at the big picture and connect to the world and people in it. Then we look at the sympathetic branch of the autonomic nervous system. Now, this is the one that gets activated when we feel uneasy. And this is something that triggers the sense danger. This is when the individual's body goes into flight and fright response. We freeze, or we just don't know how to deal with these emotions. Our heart rate increases. our breath becomes shallow, and we are constantly scanning our environment because we sense danger. And the dorsal nervous system is the oldest of all, and these are the primitive responses that are seen in reptiles, and it's like almost 500 years old. Then eventually we evolved into the sympathetic nervous system, and then the newest is this ventral nervous vagal nerve, which makes us humans. This is what we do, right? So why am I discussing all this with you, all of you? So there is a reason. So the act of yoga and pranayama, it down-regulates the sympathetic response and up-regulates the parasympathetic response. So again, sympathetic response is always being in this defensive mode and perceive everything as a threat. And parasympathetic is is where we restore, we rest, we heal. We come into that non-defensive state. We smile, we make the eye contact. We open ourselves to self as well as to others. So by doing yoga, you strengthen the vagal tone, and you remain in this non-defensive state to access the higher level of brain activity, the limbic system, the cortex, and practice compassion and empathy. And this is how we have the coherent brain activity. Now, this has been currently tested in the field of neuroplasticity and epigenetics. And yes, polyvagal theory, one of the main criticism is that it doesn't have enough evidence. But my question to all of you is, if something is really helping, why not do it? There is enough evidence that exists. Yes, we don't have robust evidence, but why not? So all of the speakers have shown and will show that it's the vagal nerve upregulation and the acetylcholine release that has been thought the main pathway of fighting the inflammation. And truly, the vagal nerve is called the healing nerve of the body, and it's responsible for the inflammatory reflex, what they call. But in true sense, I think it's really the anti-inflammatory bolus. So I decided to look for vagal nerve stimulation on Google Scholar. So many of you that are physicians, you know that it's very popular. So they take different devices. You can stimulate the vagal nerve using your phone by, and it's been proven in epileptic seizures. There are 250,000 articles, including 25 patents that came up in the top results. There are many on cardiovascular disease. There is a lot of research done in CHF and AFib. And actually, yours truly, I was part of this trial that was done when I was a fellow in cardiology at University of Oklahoma. So my question to all of you is that we try so much. We are trying to see all these things if it works on the vagal nerve, but the nature has given you the natural vagal nerve stimulation. It has given you in form of pranayama, the asanas, the behavior, the positive behavior, the positive vocalization. All of this at different spots upregulates the vagal activity and helps it fight so many systems together. So to me, yoga is not an exercise. Yoga is a lifestyle. Yoga is the way of life, and it leads to many of these things with its effect on parasympathetic nervous system. I know it has helped me tremendously. I know many of you practice it, and probably it has helped you as well. But I'll finish with this slide, which describes this Greek word, eudaimonia, and it represents this state of human flourishing or sense of well-being that is non-transitory and is often connected with sense of purpose and self-realization. It has been linked with many health benefits, which is, gene expression changes, as Dr. Gupta very well showed us, the reduction in perceived loneliness, decreased inflammation, improved immune regulation, and mental flourishing. So yoga, I think, has been correlated with eudaimonia in studies, and it facilitates many of these positive physiological, mental, and social health benefits by this. So I'll finish with a sutra then. When after a moment of stability, the mind ceases its fluctuation and remains quiet, it's then when its transformations begins to stability. Thank you.
Thank you very much, Purvi. It was an excellent talk. So I will let you introduce Claire.
Sure. I thought you were, okay. Okay, so Claire, how do I know Claire Ragazzino? So I'll tell you guys a short story. I was a cardiology fellow at University of Oklahoma. And I used to go to this yoga studio regularly. And Claire was my favorite yoga teacher. I really liked her, you know, the sense of well-being that she would bring to me. And it really helped me, attending her classes really helped me, you know, fight many things when I was doing fellowship. And when Alexandru invited me to this webinar, I really thought that it's a great opportunity for me to invite her. So Claire is an Ayurvedic practitioner. I know that she has gone back to India to practice, to learn Ayurveda, and she's the author of vidyaliving.com. Please check out her social media. She has really helped me. I just really like to see her feeds. She has organized some international wellness retreats and really is an advocate for mindfulness, well-being, as well as Ayurveda. So Claire, thank you so much for joining, and floor is yours.
Thank you for that wonderful introduction. It's an honor to be here. And let me just hit play. So incredible to see how each one of these presentations fits into this and even kind of comes as a support and umbrella under Ayurveda. So just a personal brief backstory. I came to kind of my own health journey to Ayurveda was growing up with a lot of digestive issues and an autoimmune disorder. And I found yoga, I came to holistic nutrition, and still struggling into my early 20s with digestive disorders, I really finally came to Ayurveda, which is yoga's sister science. So what is Ayurveda? It is a holistic health model from India that looks at the body as kind of an all-encompassing body, mind, and spirit in relationship to nature. So it actually translates as the science or the knowledge of life and longevity. And it's not only a preventative model, but has curative measures as well. In fact, there's 8 branches of Ayurveda medical science, ranging from general medicine to pediatrics to surgery to toxicology and geriatrics. But largely where Ayurveda's role is really coming to help us in the West now is looking at its practical knowledge for everyday self-care. And that's what I want to talk about today. It's just how we can take this very vast body of knowledge and take a few practical tips away to help boost immunity at home. So this core principles really look at the body as a part of nature and understanding how this 5-element model and these groupings of the 3 humors or constitutions, doshas, impact our body and our mind. So what is health in the Ayurvedic lens? It's not just physical health, it's also mental and emotional well-being and understanding of our soul and our relationship to our senses. Purvi's explanation of the 8 limbs of yoga so beautifully fits into this, because through yoga, we care for the body. We also care for the mind, meditation. We understand the effect of and the importance of pratyahara, right? Withdrawing our sensory stimulations from the day-to-day. And I'll talk more about that and how that really impacts our gut health as well as overall well-being and immunity. So it's understanding how we can balance these elements of the body, but also understand the role of the mind within that. So this 5-element model, if you're new to this, you might be familiar with Chinese medicine. Ayurveda similarly looks at these 5 elements, air and space being the most subtle, come together to form Vata dosha. Fire and a little bit of water forms Pitta, and water and earth forms Kapha. Now, these 3 can be understood as body types, but they're also different governing aspects of the whole system. So the nervous system could fall under Vata dosha, The digestive system can fall with pitta, and then the kind of structural waterways of the body with kapha. So when we're looking at these, we're understanding how these elements and our relationship to the seasons, our local environment, the time of life, can all impact the state of kind of homeostasis or balance within the body and the mind. So when we look at these 5 elements and how they come together, the body types are understood as prakriti, which is this unique constitution that you're born with. It's affected by your parents' genetics, their prakriti, their vikriti, which is their current state, and understanding how these different proclivities that we have can affect our metabolism, our mental well-being, if we're more likely to be anxious or agitated. These different doshas kind of help to inform our body type and how we can stay in balance and understand what could throw us out of balance more through the course of a lifetime. There's some great studies through this. You can look up more about prakriti and its association with metabolism, with the neural models, and even looking at how we can use this model or this lens of health for more personalized medicine. So when we think about our body type, we start to understand how like increases like. So if you're someone that has a lot of air and space in your constitution, you might notice nervous system disorders more easily than someone who has kind of more sturdiness and strength of a kapha type constitution. Diet also plays a really important role in this. So through the Ayurvedic lens, what we eat forms the health of our tissues. So we have these 7 tissue layers, each fed sequentially by the nourishment and nutrition that we take in. When our body is in a state of stress, much like Purvi explained, the digestive process gets disrupted, and therefore the development and the tissue health gets affected. At the very end of that, when digestion and the food that we take in, ahara rasa, is properly taken in, we have what's called this kind of strength or vitality, ojas, which in Ayurveda is understood as immunity. So this idea of you are what you eat is really important. And I want to talk a little bit more about how you eat is also really important. So how Ayurveda views immunity is this idea of bala, or strength, and ojas, this vitality. And we're born with either this kind of innate immunity or this natural strength. You can also be affected by temporal factors such as the seasons or different times of life. You know, you might have more strength as when you see a young child fall and get right up, versus as we age and elder, we lose that vitality and it becomes, our immunity weakens naturally. So what we do is this yuktakrita bala, which is acquired immunity through diet and lifestyle practices, which is largely what I want to talk about today for your home practice. So things that we weaken immunity, of course, we've already looked at this. Diet plays a big role. How we're eating and being in a stressed state while we're eating also plays a large role in the health of our tissues and our immunity. How we sleep, you know, an inconsistent routine or lifestyle also really matters. And all of this, again, contributes to stress and how we're processing the experiences of a stressful modern life. So ahara is diet. We all know that food is important, but what I want to emphasize today is how you're eating matters even more than what you're eating. Because this is such personalized medicine, giving you a prescriptive diet is really something that has to come from a physician one-on-one, working with you, getting to know your unique type. So what I want to emphasize is really establishing healthy routines around eating. I know we get busy, sometimes we forget to make meal or there's nothing available, we graze all day long. This also weakens the digestive system. So eating without distraction is another big one. Putting your phones away, no emailing, no working at your desk will make a huge improvement to how well your body can assimilate the nutrition you're taking in. And then avoiding, of course, processed foods. This includes caffeine, alcohol, sugary, fried foods, and eating instead a more wholesome diet without pesticides is really a valuable tool in terms of diet. Now, in terms of lifestyle, this vihara helps us understand how a routine really plays a role in the health of both our nervous system, how we process stress, how well we're sleeping, and the body is regenerating as we sleep. And the Nobel Prize winners in 2017 really established that the circadian rhythms play a large role in this, and Ayurveda calls this dinacharya. It's our flow of the day. This comes with waking with the sun, you know, having a short meditation or breathwork practice in the morning, maybe doing yoga or being outside. Forest bathing was one thing that Dr. Frates brought up. All of this establishes kind of a healthy rhythm as you start your day. How you eat, making sure that you're eating 3 meals a day at set time with fasting times in between, and getting to bed at a reasonable hour. It sounds so obvious, right? But we often forget to do these things, and one day leads to the next, and before we know it, we're on our computers till 1 and we're up early, and there's an imbalance that starts to come, which weakens immunity over time. So really honoring a healthy rhythm through the day is a great way to reset the system if you've gone through a period of extended stress. Seasonal routines also play a big role in this. So your diet will change through the course of the year. Watermelon makes sense in summer, not so much in winter, because like increases like, we want to eat things that are nourishing and warming in the colder months and more lightening in the summer months. And so understanding how this kind of chronobiology affects us through the course of a day and through the seasons helps make everyday decisions that keep us on track. And then of course, there are times we get depleted because that's life. And whether it's jobs or kids or things that are taking us off center, Ayurveda has a protocol of rasayana, which is rejuvenation, that includes specific diet and lifestyle practices that help to rebuild digestive fire if you have dampened the digestive fire and experiencing digestive or gut health imbalances. Rebuilding that, and then bringing in these more building, nourishing foods that help to increase kapha, that help to bolster this idea of strength and immunity. And it's foods that have this kind of building and sweet taste, building qualities like ghee and soaked almonds, dates, figs, and cooked rice. Of course, diet, again, is very personalized, and this is in no way meant to be a prescriptive diet, but simply an idea of what kinds of foods, spices, and herbs can be used in a rejuvenating practice that you can incorporate. There's lots of wonderful studies, as our previous presenters have shown, on the benefits of yoga, meditation, and then coming up breath work, and how breath work can really help to rejuvenate the body. So a few key takeaways here is that building immunity is a daily practice. It doesn't have to be all of these things I mentioned, but if you did 2 key things each day, it helps to get the digestive fire running strong, support the immune system through living in a more relaxed state in the nervous system. Proper diet and lifestyle habits can really help to build strength and vitality. Understanding that gut health also plays a really valuable role. And if you took away one thing, it's noticing that how you're eating is just as valuable as what you're eating. And then practices like yoga, meditation, and breathing not only help to support the body, but it helps to align the mind and to cleanse and clear senses when we've been overstimulated. So really, Ayurveda can provide simple tools for everyday practices you can do at home. And if I can recommend anything, it could be starting with establishing a healthy routine around just when and how you're eating without distractions, to reduce stress and the influence of sympathetic nervous system can have on reducing gut health. So I hope that this has been a quick, brief overview of a very vast body of knowledge, and it's piqued your interest to learn more of Ayurveda. And again, my last disclaimer, that is to say Ayurvedic is meant to support your health, but in no way replace not using a mask. So please wear masks, wash your hands, practice safe social distancing, and well at home.
Thank you so much, Claire. That was an excellent overview. Really enjoyed. That's our next speaker is Dr. Alexandru Mishi, who's the head of interventional cardiology in Montlucon, France. And he's also the chair of Telecardiology Working Group and your host today. So Alex is going to talk about signs of cold exposure.
Thank you very much, Purvi. So I will just briefly, for 3 minutes, try to explain what is cold exposure. I discovered this, I think, almost 9 months ago. And I should say it really provided me the tools or some tools to manage also stress and to manage to be in better or to be more fit. So cold exposure. We understand by this the exposure to cold water or ice, which is for a limited amount of time. The key question here is if we can voluntarily influence our two nervous systems through different practicing techniques, because normally we cannot do that, especially the parasympathetic nervous system, we cannot influence it. So I found this very interesting article regarding cold water immersion. And the authors state that a short-term exposure to cold readies the immune system to deal with injury or infection via the following mechanisms. There is a release of transient stress hormones. There is a short-term leukocytosis, so leukocyte living organs such as the spleen in response to increase in catecholamines and cortisol, and they are ready to deal with a threat. Moreover, over here on the right side, the authors summarize the benefits of cold exposure. So this is prolonged underwater survival, deliberate cooling for oxygen conservation and treatment of hyperthermia, pre-cooling for improved performance in the heat, improved recovery post-exercise, treatment of inflammation and upregulation of immune function. In this article, there are several figures which summarize the key ideas of the article. One of these is the association between the cold water immersion, inflammation, and depressive disorders. And here we can have the mechanisms that these authors put into this article. Moreover, we have a randomized controlled trial performed, I think in the Netherlands, if I'm not mistaken. So these guys separated two groups, an intervention group and a control group. For the intervention group, they trained the participants for 10 days into meditation, breathing techniques, and exposure to cold, immersion into ice cold water. The control group was not trained. Subsequently, all subjects underwent experimental endotoxemia. So they injected an endotoxin IV, and then they just they observed what were the consequences. So in the intervention group, in the intervention group, they found intermittent respiratory alkalosis and hypoxia resulting in profoundly increased plasma epinephrine levels. They found that plasma levels of anti-inflammatory cytokine IL-10 increased more rapidly after endotoxin administration and was correlated strongly with preceding epinephrine levels, and these levels were higher. They noticed that the levels of pro-inflammatory mediators, TNF-alpha, IL-6, IL-8 were lower in the intervention group and correlated negatively with the IL-10 levels, and that the flu-like symptoms were lower in the intervention group. So overall, they showed that the group that was being trained by all this intervention performed better in an hostile environment like a small infection. You can see here the same article with some diagrams, which I will not elaborate on because we are lacking time. This is another study based on the previous study where they showed that it is very important to have a positive state of mind in order to have a better immunity, maybe referring to the placebo effect. And I will focus on this study, or moreover case report, because the cold exposure was initiated worldwide by the Dutchman Wim Hof, which is also called the Iceman. So Wim Hof has the ability to withstand for long periods of time in very hostile and cold environments. This study evaluated and looked inside Wim Hof's brain in order to see what are the changes that that appear during the cold exposure. So what happens in the brain when, and the body when exposed to cold? We have an activation of primary control centers for descending pain and core stimuli modulation in the periaqueductal gray, possibly initiating a stress-induced analgesic response. All this has been seen on MRI. Engaging higher order cortical areas that are uniquely associated with self-reflection and which facilitate both in internal focus and sustained attention in the presence of adverse external stimuli. And you have an increased sympathetic innervation and glucose consumption in the intercostal muscle due to forceful respiration, generating heat that dissipates to lung tissue and warms circulating blood in the pulmonary capillaries. So this method might allow practitioners to develop higher levels of control over key components of the autonomous system, with implications for lifestyle interventions that might ameliorate multiple clinical syndromes. Also, cold exposure could eventually recruit more human brown fat, so could eventually lower the body weight. I just put some studies here for additional reading, which all describe the benefits of cold exposure to the body. Thank you very much. I will pass the word to my dear friend Dan DeLuise, which is a breathwork, mindfulness, and meditation coach, which is also Wim Hof Med instructor, which is the founder of subramayayoga.com. And Dan will present yoga breathing techniques, tips, and tricks. Thank you very much, Dan, for participating. Please turn on your mic. I'll try to put your presentation to share.
I think you were going to share it for me. I think you said there, Alex.
Right away.
All right. Well, thank you very much for that wonderful intro. And thank you very much. I feel very, very grateful and blessed to be here speaking with all of you and all of the people out there that are watching, and this wonderful platform that's allowing us to show that there are other ways to mitigate stress and to help us through the COVID. And yoga to me is very powerful. I'm very passionate about it. I guess disclosure for me, I found yoga with my mother. There's me at the end of the doc meditating. My mother introduced yoga to me about 17 years ago. And I, within a few years of that, I ended up getting some really bad chronic back problems. I herniated a disc. I ended up laying down for quite a while. I was in bed for almost 2 years. I developed depression, anxiety, self-medicating, a lot of medication, and I found myself kind of at the end of my rope. So I ended up with the company that I was with a very good company, a big multinational company, and I just decided to leave. And the reason why I did, which was very interesting, I was actually walking with a cane. I was only about 35 at the time, and I was 34. I was walking with a cane, and I was getting actually one of my prescriptions for Oxycontin, and I was hunched over waiting for it to be made. And there was right in my eyesight a DVD with two people around their 70s or so doing yoga on a chair. It said for back pain. And I thought, well, you know, might as well try something else. I was kind of at the end of my rope. I went home actually, and I did it. It was in a chair. We had some breathing exercises at the beginning, and then we laid down at the end, and I fell asleep, something that I was never able to do because my mind just was going and going. And it was like something just kind of ignited in me, and I felt good. I cried. It was a beautiful feeling. And from that point on, I haven't stopped. And I realized that this is the path I need to take. So I ended up leaving my job and going and living in an Indian ashram. And I lived at a Shivananda ashram, so it was very disciplined and traditional. So I learned Himalayan yoga, which is not kind of that trendy yoga. And I love what Purvi said about yoga is not an exercise. And that's so true. And that's something that I think is changing here in the West because it's seen as a very fashionable thing. And I think now we're seeing during these stressful times that the most powerful thing you can do in this moment during this crisis or in any stressful situation is to have control of your mind. And I know Alex mentioned Wim Hof, who I'm one of his assistants now, and Tim's on here also. It's amazing when you're with him because we just practiced mindset. The cold exposure and the breathing are what bring the mindset, but those two things get us there very quickly. And for me, I've been a breath coach for many years. And one thing that I saw from the breath work, especially when I showed up at the ashram, I was limping, a lot of pain. I was detoxing, trying to come off all of this stuff. And my teacher, it was funny, I'd always talk to him trying to find out, you know, how are we going to fix this? How are we going to fix this? And he kept telling me I was lazy and I was a bad boy. And I was like, he says, but now you're a good boy. He says, and now you're not lazy because you're here. And every time I talked to him, it was like I was trying to get him to validate why I'm feeling this suffering and pain. And he said, no, he says, you know what, you're going to figure out one day. He says that all your problems aren't everybody else out here. It's your internal world that you have to fix. So I love the inner engineering that Sadhguru uses and all these other mystics when they say our inner world is the world we need to take care of. Now, yoga strengthens and breath work strengthens the power of your mind. And the more control you have over your mind in terms of a conscious mind, this is going to help you control the subconscious programming or belief systems that aren't serving us. And we become more and more aware of that. The more power we have in the mind means the more power we're going to have in our life. I fell into a trap of, you know, making excuses. And the one thing about the yoga when I got there is the discipline. And it was true when he told me I was lazy. It's because I was letting the mind stuff take over. And the mind stuff is what was leading me. You know, science shows, and everybody today talked about it, that, you know, most illness comes from stress. You know, what is stress? It's the mind overworking. We're consumed by the fears, causing us to kind of feel lost in the world. And with so many things going on, especially right now with COVID, more and more yoga is needed to, and breath work is needed to help us mitigate through this, to be able to control the mind. And even Purvi and these other presentations show that we're able to control the rest of the stress response. And using breath techniques, we're able to dial into the autonomic nervous system and the nervous system, and we're able to control that, which seems to be out of control these days, especially because the modern condition is to be distracted in technology and we're not focused. Well, breath work and yoga helps us bring the focus back in. And you'll see here on the slide, like the yoga practices, postures, breathing, relaxation, and meditation. Those are 4 points. So yoga is not just about the exercise. The postures are great because it helps us in our modern condition that we're trying to attain all this comfort. And in our comfort, I think we're being unsuccessful as humans because it's weakening the physiology. But the postures, when you go to a yoga class, you are in that posture. You have to focus and struggle a little bit to stay there. You also have to connect your mind, your body, and your breathing. And that's one thing that right now, the modern condition, the modern world doesn't have. We're distracted. And yoga and breath work are going to be very, very fundamental, I think, in helping us heal, especially in the future. And Purvi said, do you think Patanjali 500 BC was sitting there writing the sutras saying, yeah, I wonder if in 2020 they're going to really need this, because those sutras are beautiful. I studied them, and it's really just a roadmap to the mind. But when you look at fitness here, fitness is a very big part of your health, but self-regulation and awareness, you'll see the next two in the middle, are probably just as important or even more powerful for you in helping. When you self-regulate, and this ability to step away and become the observer of your life, that's what yoga shows us. And that's really the first step when we're doing our tapas and our austerities, and that is that we start to actually be able to look at what we are seeing in our life and what we want to change. The great thing, and we'll go into the breath work now, is that it promotes self-regulation. The breath work creates even more awareness, and in these mind and body practices, our mind, they're showing in epigenetics and all these different sciences showing that the mind is probably the most powerful thing in helping us with our health. So the mind is probably the most powerful thing we need to be able to strengthen the immune response. See, yoga doesn't, yoga's and breath work and meditation teach us that we're still going to have stress coming in. It's just the response that we have to it coming out. And Alex was mentioning about the Wim Hof method. It's probably one of the most powerful ones that I've seen. That's almost like a reset. It's almost like it resets the limbic system and the autonomic systems, allowing us to almost start from scratch again. But it's the belief systems in the modern condition that have us always being pulled back. So for me, when I do a lot of personal coaching with people, the one thing I work on, and I'll give you, you can have yoga and meditation and breath work practice, but the most important thing is the mindset. And this is the most important thing the world needs right now. The modern condition in this escape-based technology world we live in has us looking somewhere else, but we need to look inside. And the breath work and yoga allows us to come back inside and kind of figure out what's going on here. The modern condition has us outside, and it's kind of where we're just being distracted, looking for that next dopamine rush or whatever. But then yoga has us focusing on the inner world. And the inner world is where the strength is. The outer world and the mind stuff and being consumed by the fear, whether it's COVID or even before COVID, that has us becoming weak as we are always in stress. And the systems, we know when we're stressed, the immune system takes a back seat. But all of a sudden we start to realize in yoga, it takes us back inward. It allows us to realize that comfort, yes, is great. We're going to have to live in this technological kind of escape-based world. But the reason why yoga is so beautiful is that it encompasses the mind, the body, and the breath. And we stress ourselves. I know Beth mentioned at the beginning, and stress is very good for us. It's the chronic stress that's not good. That's why yoga and breath is so amazing, is that it enables us to bring down inflammation. And we do these short-term stressful exercises. And when we stress ourselves positively, this eustress, the body, it's like, say you go to the gym and you lift a weight. Well, you lift it and you put trauma and stress on that. That thing comes back stronger. We can do this with the immune system. It's very, very complicated things, cells and molecules and organs, but yoga goes inside and it works all of those systems. And it's amazing to watch. Now, I'll finish with this, is that I did go to the ashram, and I told you how I went in with a cane. In 2 weeks, I was playing football for Europeans and soccer. I was playing, crying for 3 days because I'd never felt so good in my life. And one thing that my teacher was telling me, my guru and my swamis, and the inside world and the outside world, it made me realize that when I control the inside world, when I'm able to be conscious and aware, and my conscious mind, and I start to strengthen it, then we see the belief systems very quickly that take us offline. And instead of the stimulation coming in and there a quick reaction, all of a sudden the stimulation comes in and we can create some space in there. And in that space is your freedom to make the right decision. You know, we've all done that when somebody said something and then it comes out and we go, oh, I should have waited. But that internal world that we don't know about, well, it's ours. It's our innate intelligence. We were born with this. This is something that can change our lives with one breath. Now I'm going to show you one breath technique that I give to doctors and nurses, especially you guys, and I have so much respect for you guys and what you guys are going through right now. People take breath breaks and yoga, cigarette breaks and lunch breaks. Sorry, but we can take the breath break. Now we're an adaptive mechanism. So we're an adaptive mechanism and we're fragile. That's why we need the hormetic stress, or we need that stress. And if we don't stress, we're going to become weak. Now, one technique is just 4 breath. You inhale and count 4. You hold for 7. And when you hold for 7, physiologically, the nervous system says cutbacks, no more energy, slow the heart down. The heart slows down, and then we do this. We create a back pressure, and we blow. The nervous system slows down even more. We stimulate what you guys were saying, the vagal nerve, the 10th cranial nerve, the vagus nerve. One breath changes physiology. What happens if we did that 4 or 5 times a day, taking 5 of those breaths 5 times? The nurses that I work with and a lot of the doctors and anybody that I work with in coaching, that's the #1 breath work. Wim Hof's the most powerful one that brings it all in and does all kinds of stressing in there. And you have a beautiful response to that. But put that one breath technique and make it something, because we're adaptive, we need a behavioral change. And we know this thing's plastic. It can be molded, but yoga is one of the most beautiful things to shape that brain structure to how you want it to be. So try that breath technique, the 4, 7, 8, 5 times. Go on my Facebook page and you'll see I got lots of classes on there for free. And we do that at the end, just before meditation. And meditators even tell me, they're like, wow, that makes a difference. Practice it before you go to bed. It's called the sleeping pill. Andrew Weil, Dr. Andrew Weil in the United States. You guys some of you may be familiar with him. I love his work. I give that 4, 7, 8 to people that are, he calls it the sleeping pill, that have insomnia. Every night I give them a thing to journal, positive affirmations. Think of 5 things you're grateful for. And in 5, 4, 7, 8 breath. In 1 month, somebody that has insomnia that I worked with sleeps all night long. Structure, behavior, that's the mindset that we need, because talent isn't the reason why you should do something. Everyone has a growth mindset in them. They just have to find it out. When we can grow, we don't have to have talent. When we tell somebody, oh, you're a genius, you're so smart, what happens when they fail a test? Their identity, they go to school, they see somebody smarter. But growth mindset is like I do with my son. He comes in with a 9 out of 10. And I say to him, I don't say, that's great, you're awesome at math, you're Einstein. I ask him how he got that. And he tells me he worked hard. And then I tell him, that's why you got that mark. There's no identity to it. It's growth. And that's what we are as a cellular machine, is something that can grow. No ceilings. Our mind creates ceilings with fear, and the breath shows us how. Human trajectory is like this. We should always be evolving consciously. So anyways, that's my little thing. That's a simple breath technique. I hope you guys get something out of that. So
thank you very much, Dan. So can you just please repeat the technique for one more time?
Okay, so 4-7-8 is just inhaling through the nose, 4 with a nice slow, and you count, eyes closed, you hold and count 7. And then on the exhale, we count 8 in the mind, but we want to blow and create a little bit of pressure. Helps us to control the breath coming out and slows things down. And you do 5 of those, 4 or 5 breath. I like to tell people going into a meeting, especially before you eat, if you're stressed, because you want to get that parasympathetic. You don't want to be eating when you're stressed out, because you're just going to use all your energy switching over. Use it to go to sleep. I use it every night, and my wife, she laughs because she goes, you don't even finish the first breath and you're sleeping. But I've been practicing it for about 5 years now, so I'm getting good at sleeping. You practice anything, you get good at it.
Great, thanks. This is great. So thank you very much. For those who are online, just check Dan's website and courses on subramayayoga.com. You can find his website on the first announcement.
Yeah,
thank you very
also
much.
I got onlineyoga.ca is the new coaching one that I'm just putting out. So it's just as it says, onlineyoga.ca.
Perfect. I will be following those courses for sure. Thank you very much, Dan. So I have the pleasure to give the word to Tim van der Vliet. Thank you very much, Tim, for participating. So Tim is a breathwork, mindfulness, and meditation coach. He's also a Wim Hof method instructor. Check out also his webpage, timvandervliet.com. And Tim will present to us what are the tips and tricks of cold exposure. Tim, sorry if I mispronounced your name. Sorry, I'm very bad. Not bad at English, at night especially.
You know, I love the way my name is pronounced. It's in every language different. But it's Tim van der Vliet. I'm Dutch. I'm living in Amsterdam. That's why I hear this accent also from me, you know, my beautiful Dutch accent that I'm trying to lose for a long time, but I can't. Dan, maybe unmute yourself. Mute yourself.
Okay.
Thanks. All right, so I'm gonna talk a little bit about, more about how to build up cold training. So this is very practical. And, you know, like I love to listen to all these speakers because, you know, I hear like what I believe very strongly, and I hear other people say it in a slightly different way. So, and it's great I'm after Dan, and Dan is a great friend and also a Wim Hof instructor. Let's do something first. Let's take an extreme slow breath and breathe in through the mouth. I know through the nose is healthier, but you know, we got to break the rules sometimes. So breathe in through the mouth as slow as you can. Filling up your belly, then your chest all the way in. And breathe out as slow as you can. Maybe you notice you feel your skin. Maybe you feel a little yawn come up. Totally fine, except for the other speakers because I can see you. Breathe out as slow as you can. That's like my main message. The secret that makes my life a lot better is to be able to slow down my breathing. Yeah, what happens if we go into stress? We tend to breathe high in the chest, and even worse is to hold it. So that's our natural physical reaction from being in that sympathetic nervous system. Now, if you're able under stressful moments to slow down your breathing, you will notice that 90% of the stress that is made up here, you know, like I see Dan looking away at me, and it makes me think of my brother when I was 4, and you know, like story going on and on and on. 90% of the stress that we encounter is in our head. And the other 10% of the stress is real stress, and you want to be able to stay calm. You know, like a little anecdote. 2 guys are walking in the jungle, and 2 best friends, by the way, and suddenly they hear this noise coming out of the woods, and there's this tiger, you know, like big tiger in front of them. So they both completely freak out. And one of them is very calm. He bends down and he starts to do his shoelaces. And the other friend is screaming at him like, "Are you crazy? You think you can outrun a lion?" And he looks up and very calmly he says, "No, but I can outrun you." This guy stayed calm. He knew how to slow down his breathing. Now, let me share a few slides. So, you know, we talked about it already. So like this first slide, I'm going to skim through it.
We can't see your presentation, Tim. So just make sure you open your presentation first and then just click on the share screen.
Yes.
It worked at the rehearsal, so yeah.
Here it is.
Yeah, perfect.
Okay, so this is just like a little, you know, summary of how do you boost your immune system through cold training. And I'm gonna be a bit fast towards this part because we heard a lot about it already, and you're all very intelligent people that probably can find out a lot about this yourself. So cold training increases our metabolism. If you don't like to work out, you do want to drop weight, cold training is the way. It trains the cardiovascular system. Cardiovascular illness, as far as I know, #1 cause of death in the world. Yeah, we age somewhere in our head, near the lungs, a blood vessel pops and you die. 30% of the people in the US die of cardiovascular. That's why we're here, right? It's a cardiovascular training. Through cold training, you release endorphins and dopamine, neurotransmitters, happy hormones. Makes your life better. Get into that positive mind state. The next one just always blows my mind, especially in these COVID times. And also, you know, disclaimer, please wash your hands and all that stuff. But through cold training, we make more white blood cells. I mean, that is amazing. White blood cells protect us against bacteria and viruses. So, you know, like to protect yourself is good, but you want to be strong from the inside, as we all talk about. You can make more white blood cells by having a simple cold exposure training. It brings down inflammation. And then, like my biggest takeaway from, I think I've done at least 500 ice baths, is to be able to cope with stress. Which you already know the secret by slowing down your breathing. Let me go to the next slide. So very short, like what is cold training? You know, how do you train cold? It's ending your shower cold or having a cold shower, the most simple form. Very practical, doesn't cost you any money, doesn't leave any environmental footprint. Just ending your shower cold. Then there's cryotherapy. It's like standing in like a freezer and it's like very dry air on your bare skin, and which is much more intense than a cold shower. And then there's ice bathing, which is the most intense. And just to, you know, like, I know I may sound a bit cocky when I say I did 500 ice baths, but I've put many people into ice bath, like, I don't know, a few thousand. And like everybody is always better than me the first time. And my first time in an ice bath, I was guided by Wim Hof himself, who doesn't really guide, by the way, but I jumped in that bath. Now I know you don't jump, you take it easy, slow down your breathing. But I jumped in that bath and 3 seconds later, I was out already. And in those 3 seconds, I had this scream of, you know, like I was dying. So cold training is something you can learn. I know part of you will be like, oh my God, an ice bath. The idea only makes me shiver. It's something you can learn. And I'm the example of that, because, you know, like I really didn't like the cold, and the ice bath was just pure hell. Around ice bath number 5, I had an instructor whispering in my ear, slow down your breathing. And this is where it clicked for me, you know, breathing slowly. I'm very repeating myself because I like to be boring, basically. Now, how to build up cold training. So you really have to know that cold is a stressor. Yeah, it activates that sympathetic nervous system. Now, is it bad? We've heard it before, so I'm not going to get too deep in it, but we have like green stress and red stress. And if you are, green stress is like exercise. If you're doing yoga, you're activating the sympathetic nervous system. If you're going for running, you're activating the sympathetic nervous system. That is not bad. That is actually what makes us grow. Yeah, but if it's too far out of your, too much out of your comfort zone, red stress, basically, or like I haven't had a running practice in 3 years, and I start with running a marathon without training. You know, that is clearly not very clever. So you have to know that also cold is a stressor, and you don't want to overdo it. So gradually build up, and my way of living myself, but also what I tell all my clients is start with baby steps, you know, building up a morning ritual, for example. And when you do baby steps, rather end your shower cold 30 seconds for the rest of your life than do this month extreme cold training, maybe even hurt yourself and never do it again in your life. Yeah, baby steps is key. And what is, you know, like how do you work with baby steps? Well, baby steps, you do them every day. And when in doubt, you take a step back. So my cold training, I give like between 2 to 10 trainings a month. I don't buy ice for myself because I feel my footprint is big enough with flying all over the world. So I only take an ice bath whenever I give a training. What is the rest is just ending my shower cold. What is the most important part of my cold training? Ending my shower cold and doing it every day. So a little bit about research, and I just took 2 of them. And I still feel that the research about cold training is a little bit thin, but you know, like I'm critical, like most of you scientists are probably, which is a good thing. Not always though. So one research showed that the difference between no and not ending your shower cold and 30 seconds was very significant, but there was no difference between 30, 60, and 90 seconds. So that proposes that baby steps are good enough. 30 seconds ending your shower cold, rest of your life, you really will know the difference. And the other piece of research shows that after 2 minutes of ice bath, which this is where the most benefits are, like really, this is pretty mind-blowing for me. 2 minutes ice bath, up to 6 days later, if you measure your blood values, you will have more white blood cells and less inflammatory proteins. 2 minutes, 6 days. And you know, when we talk about that, you know, like there's a lot of, it's maybe because of Wim. Wim is like this, ooh, this guy, but it attracts a lot of, the Wim Hof method attracts a lot of guys that want to push it. And the real message of this Wim Hof method is how do you cope with an ice bath? How do you cope with your stress? It's not about fighting against the ice bath or fighting against the stress. It's about surrendering to. And so I feel that's a very opening and very heartwarming message. If you learn to surrender to stress, you will have much less than when you fight against stress. And then, of course, you know, getting back to how do you do it? It's really slowing down your breathing, and that's it. So it's very, very simple. So if you take a cold shower, for example, you know, you're nice and warm, and you're gonna do it. If this is your first time, you put it on cold, you take a deep breath, and then while breathing out, stand under it. Make sure your shoulders are low. Another deep breath. turn around, put it on your back, another deep breath. If you want, you can put your head under. Maybe you want to try it without first. Some people get a brain freeze, but build it up gradually. If you take 3, 4 of those breaths, you're already at 1 minute. And it's much easier than you think. And the same in an ice bath. So, you know, like, what is the secret to cold training? Breathe slow and deep. And that's it. And this is also what I have to say. So thank you for your time.
Thank you very much, Tim. This has been a really a pleasure. And so in just in 30 seconds, how do you suggest that anyone can start the cold exposure at home? Should they start with their hands and feet for like for 2 minutes, and then the next day should they start with the whole body? What is your opinion? But just try to sum up in 30 seconds.
Well, yeah. So cold training, shower, ending your shower cold, full body. And when you talk about an ice bath, I would go to, you know, like somebody who has guided somebody before, because just doing that at home, yeah, you can watch one of my YouTube videos, but I would like seek normal guidance for that. If you do hands and feet, that is easy to be done. You buy like 5 or 10 kilos of ice and stick your hands in, slow down your breathing. And if you've done that, that is more difficult than lying in a full ice bath with your hands out. So if you want to try it at home, then you know that you're able to do that real ice bath for 2 minutes.
Great, thank you very much. Thank you. So, guys, we will have just 10 minutes for open discussions, and then we'll have to end because we are already a lot out of time, let's say. So I would like just to give the word to Dr. Griffith, which is in the US. Dr. Griffith is a board member of the ISFTH. And I think she wanted to say a few words. I don't know if she can hear us, but
I can hear you. Can you hear me?
Hi, Michelle.
Hi.
Very nice. Thank you for participating, and it's very nice hearing you.
Oh, so, it's great. Yes.
What are you thinking of our webinar? I know it's a little unusual, and you know. Most of the doctors and the nurses might not believe in these practices, or might not believe that these are something that add up to what we do usually, what doctors do and nurses do. What do you think?
Oh, I must say I was thrilled, and unusual is good. Unusual is good in this circumstance. As a member of the ISFTEH and board member, I'd like to thank you all for bringing this wealth of information and educating our participants on practices that are so underutilized, but so valuable. So I will say, as a primary care physician here in the States, the intentionality of restoring your mind and body, as well as being proactive about stress management techniques, happen to be things that I discuss regularly during every physical exam. So I was very happy to see that the working group in cardiology, when cardiology was actually sponsoring this particular webinar. So I thank you all, and I hope that you make it available, because I'd certainly like to share with my patients. I'd like to share it with other colleagues, because I do find that, yes, traditionally we were trained one way with respect to allopathic medicine, and where that emphasis is on disease and not prevention. But I find that in the States, many primary care physicians are very open to this integrative approach and utilizing and educating our patients about these techniques. So thank you so much. And I certainly learned a lot about cold exposure. I didn't know anything about cold exposure. So this has been valuable, very valuable. Thank you so much.
Thank you so much for your intervention, Michelle. Yeah, so I've been practicing cold exposure for a few months, and I have to say it's really great, but we don't have time to develop this now. So I will get back to our dear speakers and maybe address a few questions. And I would really appreciate it if short answers will be given, because we are lacking time. So my first question is for both Beth and Claire. So I would like to ask them what, in their opinion, what is one simple shift that can boost our immunity?
I'll start that one. Just to echo Tim's presentation and to echo Dan, I'm going to say 5 deep breaths before you eat is probably the most effective thing that you can do to take your body out of the sympathetic nervous system into this relaxed state, so you can actually digest what you're eating, which of course in turn through the Ayurvedic lens turns into vitality, strength, and ojas when we have healthy tissue development. So if there's anything that you can do, whether you're at home listening or you're on a lunch shift, sit down, 5 deep breaths, and then eat with presence. That would be my recommendation.
Thank you, Claire. So Beth, how do you think we can convince our dear colleagues, doctors and nurses, that this is really beneficial for our mental health and for our overall health? What is your opinion? I know you've been practicing yoga for a long time. You're an expert. You even showed us, the board in the water. So congratulations. How do you think we can convince doctors and pretty much everybody that this is really beneficial for your health?
Okay, terrific question. May I also address what is one thing that you might do that could really help? And I'd like to just mention adding fruits and vegetables, especially citrus fruits, red bell peppers, to your diet. That's one thing that you could do. It's a simple swap out that you could do that could really help you with your immunity and your health. So that's one. Then I want to get to this very interesting question, Alex, which is how do we convince, or how do we open the minds of our fellow colleagues, cardiologists, primary care physicians, nurses, even health coaches, to this idea that yoga is healthful? And I'd say it's what I've used for the past 15 years to try to help lifestyle medicine move forward. And that is show them the value by giving them the opportunity to practice it. So when I was a resident at Spalding in physical medicine and rehab, I did a study and we looked at exercise. We asked primary care physicians if they exercised, if they did aerobic training, if they did strength training. And we asked if they counseled on it. Do they counsel on aerobic training? Do they counsel on strength training? And we found there was a correlation. So those that did strength training counseled on it. Those that did not do strength training didn't counsel on it. So what we have been doing in CME courses for physicians is providing yoga classes and providing other exercise opportunities for them, strength training, things that they're not necessarily comfortable or familiar with. And when you have the practitioner practice themselves and they feel the benefit for themselves, then they are more likely to believe it and then counsel on it. So I would recommend that we get together and do online yoga classes taught by Claire. This is brand new. I'm just bringing this up right now. But I'd love to take one of Claire's classes. And we do this online. At least give people the opportunity to feel it for themselves. Now, if you're in an academic institution like I am here at Harvard, whenever I went forward to my chairman, I needed to show him the money, show him the randomized controlled trials, show him the meta-analyses, show him these studies. And now I talked about them early on in this webinar, where I tried to expressed there were 20 randomized controlled studies. And then I even shared, then there's this one small seedling study, but the data speaks to my colleagues here. So I would do data driven, and then I would also do experiential. That would be how I would approach yoga and trying to get it mainstream in medicine for the practitioners and for the patients.
Thank you very much, Beth. Thank you so much. Maybe one short question for Mohit from the audience, and also from my part. So Mohit, how do you think that meditation helps you in creating a conscious future? I know it's very difficult, but can you compress it to 30 seconds, 1 minute? Thank you.
Thank you, Alexander. So now what happens is that, it's all about synchronicity. Just like when you play an orchestra, there are different instruments, but only when they are playing in synchronicity, beautiful music is created. So similarly, you have 50,000 thoughts in a single day and 50 trillion cells in the body. So when your own mind, meditation is all about creating synchronicity in thoughts. So when all 50,000 thoughts are pushing our 50 trillion cells together with positivity, with love, with compassion, with care, with peace, and with self-transformation first, and then we radiate this energy outside, you can create your conscious future. And this is very well proven, again, by a Harvard neuroscientist, Dr. Albert Pascal Leon, which he created that, nerve cells that fire together, they wire together. So repetitive thinking, you are doing the same positive thinking again, same energetic thinking again and again, again and again. So 3 weeks to 3 months it takes to design the whole new program. And that is what we all need to do. My message to you is that change is not an event, it's a process. Similarly, meditation is not an event, it's a process. So we do it gradually, and we transform ourselves. Whatever floats your boat, you can choose that. And when you keep on doing one particular thing, you are able to attract everything that you want in your life in a beautiful way. That's a conscious future you create by your own thoughts.
Thank you very much, Mohit. Very nicely said. Thank you very much. So
I was going to just add one thing. Sorry, I had to drive and come to hospital, but I was just going to say the example I like to give is when you pour water from a water bottle, it spills everywhere, versus when you pour honey, it has a flow. So basically meditation is bringing out that flow, in the life. And I'll stop there.
Thank you, Purvi. Yeah, unfortunately, Purvi had to go for an emergency at her hospital, but she hears us. And Purvi, when you get to the hospital, just tell everybody that they should practice more yoga. I will do that tomorrow in my hospital, of course.
I do it every single day.
Great. One more question for Dan and team. So guys, how do you think meditation and cold exposure helps in how do you think meditation and cold exposure helps our overall health?
Dan, you or me first?
Okay. Then you have to switch on your mic.
Shall I go first then?
Yeah, so, please go, Tim.
Yeah, so for me, the cold brings you instantly in the moment. There's no fake spiritualism within the cold. There's no future, there's no past. You have to be in the moment. And you get to withstand it by breathing slowly. And then the meditation, well, I leave the meditative part to Dan, because otherwise I'm just speaking. So Dan, over to you, my friend.
I think yoga is gonna, it's so important this day and age, and it'll go back to the mindset. The mindset I had when I was sick was very fixed, and this is what I am. And yoga taught me that that my world inside never stops expanding if I get in touch with it and I'm not living out here. Mindset, there's a Carol Dweck, very awesome book. When I create mindset that's growth in my clients and my coaching, whether they're top Olympic athletes or captains of industry, that's the first thing that we work on, is growth in the mind. The mind creates too many ceilings, yoga, meditation, and breath work create a different way, a way for you to turn inward and stop living on the outside. The outside world's going to come at us, but when we go inward, it allows us to create a mindset that we're in control. And when we regain that control with our inner world, then that outer world starts happening like we want it to. Or, you know, just things come at us. And like we said before, stress is coming. But if we learn how to respond to it properly, and all of those answers are on the inside, and meditation's there, breath work. I know meditation, I'll just say one little thing. It sucks. Most people don't like it. Nobody wants to sit there quietly with their thoughts. They want to jump out the window. Breath work is the hack. It's almost like the hack for the nervous system in the brain. It's like strength training for the nervous system in the brain. When we do our Wim Hof breathing, you come out after and you just go into this deep relaxation. Then you become that metacognition. You can see yourself thinking. All of a sudden, you're at the center. If we go to the center, we can move from any direction. We see everything coming. The breath in yoga bring us in here and keep us from living in fear out there. So.
Thank you very much. Thanks, Dan. So I'd like to thank all of you for participating to this very wonderful webinar. This is a very atypical webinar for me also, and I think for Beth and for Mohit and for Purvi, because we're medical professionals. But we really believe in this. We believe in what we just did, and I hope more people will practice this at home. This being said, I would like to say that all these techniques help improve the overall immunity, but please be careful. And of course, during these tough times, the COVID virus times, make sure you wear proper protection, masks, and wash your hands. What we just presented helps and will, if you apply it correctly, will bring an extra to your already functioning immunity. So thank you very much, Beth. Thank you, Mohit, Claire, Dan, team, and especially thank you, Purvi, for your help and effort. We're seeing you at the hospital. Go save some lives, and I hope to see you soon, all of you, I hope.
Thank you.
Thank you.
Thank you so much.
Thank you, bye.